everyone. I'm just here to give you some quick tips for those new parents with a newborn. Actually, just one major quick tip. All we are really asking for in that newborn visit in the first few months is all you have to do is focus on feeding the baby. It's so easy. Don't overwhelm yourself with all these other things. We just want the baby to be fed, and we want them to hit those weight milestones and grow. And that's it. So if that means breastfeeding, fantastic, good job. If that means formula feeding, excellent. I am not anti-formula at all. I think we got to get rid of this mom guilt of only breastfeeding and trying to stay away from formula. Formula is nutrition. There's nothing wrong with formula. We need to normalize formula feeding. I think we should be pro-choice in formula feeding. That's okay. I formula fed both my kids. I just wasn't really a good breast milk producer. I gave them what I had, and then I supplemented with formula, and they're fine. There's nothing wrong with them. I mean, well, the 6-year-old is on his 2nd year of kindergarten, but it's fine. We're all very supportive. He's doing great. Thank you for asking. And my second, yeah, he did fantastic. I mean, well, he had pretty bad eczema and bronchiolitis at 2 months old, but we got over it. His skin's clear. It's okay. I'm kidding, of course. I mean, those things are true, but it's fine. If you want to formula feed your baby, that's fine. So one thing, feed the baby. That's all I'm here to say. Well, okay, 2 things. Feed the baby and don't shake your baby. Just try not to shake your baby, okay? That would be really bad. That might kill your baby. So just feed it and don't shake it. Done. Easy. Okay, thank you. Well, this just popped into my head. Okay, so 3 things. Feed the baby, don't shake the baby, and you should vaccinate your baby. Now, for a lot of you guys listening, that's obvious. Of course, you're gonna vaccinate your baby. I vaccinated both my kids, perfectly healthy, very safe, very effective. Now, okay, so we're gonna feed the baby, we're not gonna shake the baby, and then you're gonna vaccinate your baby, okay? Done, easy. What? Okay, well, this is important too. Don't sleep with your baby in the bed. That's another way to kill your baby. So you can roll over the baby. It'll die, it'll suffocate. It's an increased risk of SIDS. I know it's very, very tempting to just fall asleep with your baby right next to you in the bed. And I know you're gonna be very careful, and I've heard all the things, but it's safest just put the baby in a bassinet or a crib. Okay, so what are we on? 4 things. You could do 4 things. Well, then, okay. Well, okay. For your mental health, don't listen to grandparents or anyone trying to give you advice about your baby. You guys are the parents. You know what's best. So if your family members are, telling you to give the baby needs water, if that doesn't feel right or sound right, you need to cross-check with your pediatrician, okay? No, you're gonna hear, we always gave the baby beer. Everyone did it. Everyone smoked around their baby. Everyone's so uptight these days. That should sound an alarm in your head. Okay, so 5 things. You're gonna, what are we gonna do? We're gonna feed the baby. We are going to not shake the baby. We're gonna vaccinate, and we're not gonna co-sleep, and we're gonna tell grandma to go to sleep. Okay, that's it. 5 things. 5. Okay, I'm gonna end it there. Oh, well, this is important. Okay, I'm just gonna say one more thing. You should give your baby a bath once in a while. Not every day, but like bathe the baby, especially in the diaper area. You know, urinary tract infections are actually a pretty common cause of fever in the first year. So just really get into those crevices. Okay, that's it. I'm done. I'm just gonna, shoot. Okay, talk to the baby a lot too. Talk to the baby. Yeah, because they, you know, they learn language and they look at your mouth and your intonations and your expressions, and that's how they learn language. Very important to talk and read and interact with your baby verbally as much as you can. You know what? Okay, I'm gonna just read this pamphlet. This will go over everything. It's a quick read. There's a lot of pictures in here. Yeah, this will tell you everything you need if you could just get one of these. And and this one too. This is an important one. This is the red book. This is any possible horrendous infection that your baby could have and how to treat it. We'll go over all this in the first visit though. Okay, easy. You got this.